evening, ladies and gentlemen. I think that you can see me well, but I hope that you will listen me well. So, all your eyes on the PowerPoint slides. Okay. So, I am sorry. Yes. So, my name is Maria Rusaka. I'm coming from Latvia. I am a psychiatrist and I am PhD student as well. I'm working in Riga Central Psychiatry Hospital and I am studying in Riga Stradins University. So this is one very small part of my PhD work, which I'm making with Professor Rancans, who is the chief of our Department of Psychiatry. So, some words about introduction. As you all very good know, that model of mental disease classification by Kraepelin is based on two types of psychosis. One is schizophrenic, when changes patient's personality, and other is affective, which was characterized by mood disorder, periodic course, and variable outcome. A lot of other scientists describe a typical form of the psychotic disorder, which differs from schizophrenic type and affective type. A lot of scientists called, for example, Rancans like Buffet de la Rente in Francais, Wernicke cycloid psychosis in Germany, Jaspers first, who found a strong link between a psychotic episode and stress and named it reactive psychosis. So later, all these scientists' observations were collected and created separate nosological unit. In ICD-10, it is defined as acute and transient psychotic disorder, ATPD, and in DSM-4, like a brief psychotic disorder. So, this disorder characterized by brief onset, polymorphous symptomatology, and rapid resolution, and this disorder can achieve complete remission, not like schizophrenia, as you know. So, what we know about stressful life events and psychosis? We know that stressful life events, especially before 3 months, may trigger many cases of first episode psychosis. By Rune, we know that stressful life events has strong association with changes in gray matter volume in brain regions, a decrease in gray matter volume in the anterior cingulate hippocampus and parahippocampal gyrus by Papagni, and we know that stressful life events have some association with genetics. Very interesting study by Stefanis found that functional polymorphism in COMT gene was associated with moderation of stress-induced psychosis. So, about acute and transient psychotic disorder incidence in the world about 1, 2, Denmark about 10, in Latvia it was about 12 in 2000. So now I will speak a little bit about my study. It was a retrospective chart review study of all first-time hospitalized patients fulfilling ICD-10 criteria for ATPD, treated at the Riga Center of Psychiatry and Addiction Disorders, Latvia. And this sample was very representative because actually this clinic have 1/2 of all patients from my country. And during 3-year period, and this follow-up period was about 6 years. What we find? In this table you can see some demographics and diagnosis longitudinal changes of the study group. Total number of patients was about 300. We was extremely surprised when we find that 62% of our patients was not rehospitalized during 6-year period after first episode of psychosis. From patient's part, which was rehospitalized, of course, 71% this diagnosis was changed to schizophrenia diagnosis, more prevalent in men. What about stressful life events? We take very broad definition and we see these stressful life events 6 months before first episode of psychosis. Totally, we find in 44% of our patients, little bit prevalent in males. What we find? Most common stressful life events like death of significant other, 13%, separation, divorce, 16%, change of job or school in 29%, serious illness operation in 16%, at work in 17%, and major journey in 16%. In this figure you can see all these stressful life events. What else can I say? We find statistically significant gender differences. We find moving house in 13% of patients totally, and in 85% of males, and only 15% of females. But serious problems in family, totally in 22% of patients, females was 62%. Discussion. We find large part of our patient had this stressful life event before psychosis. We think that it is an important factor which can produce development of disease. We know that further prospective research on this topic is warranted. And thank you very much for attention.